is ably represented by Professor Mobolanle Oniya. Professor Oniya, can you please rise? So ladies and gentlemen, this is Professor Oniya. He was born in Ibadan, Oyo State, into the family of Elder Oluwafemi Oniya, a retired university administrator. He began his administrative and academic journey at the University of Ibadan, where he earned a BSc in Zoology 1995, an MSc in Parasitology in 1998, and a PhD in Parasitology 2008. In 2000, he joined the Federal University of Technology, Akure, Futa, as an assistant lecturer in the Department of Biology. His passion for teaching and research has kept him within the university system throughout his career. Professor Oniya has made significant contribution in the field of parasitology with a focus on epidemiology and control of neglected tropical diseases. His extensive research on schistosomiasis in Ondo State earned him the role of chairman of the Ondo State Advisory Committee on Neglected Tropical Diseases, a position he has held since 2013. Under his leadership, the committee has set ambitious goals to eliminate 2 neglected tropical diseases in the state by 2027. Throughout his academic career, Professor Oniya has contributed to the development of postgraduate programs at FUTA, including the Master's Program in Environmental Biology and Public Health and Applied Parasitology, which have attracted students from across the country. He has supervised over 80 BSc projects, 25 MSc dissertations, and 10 PhD theses. Ladies and gentlemen, he has also served as an external examiner for postgraduate programs at several Nigerian universities, including the Obafemi Awolowo University, the University of Ibadan, and the University of Lagos. His teaching portfolio covers a range of undergraduate and postgraduate courses, such as general biology, parasitology, pest and vector management, and epidemiology and control of parasitic diseases. As a researcher, he has focused on diseases like onchocerciasis, soil-transmitted helminthiasis, and malaria. His work in Ipogun, Ondo State has led a significant reduction in the prevalence of schistosomiasis, especially among school-age students, the group most vulnerable to the disease. Professor Oniya has also held various administrative and leadership roles at the Federal University of Technology, Akure, including Head of Department Biology 2019 to 2023, and several positions in the Academic Staff Union of University. He's a comrade, where he championed better funding, infrastructure, and working conditions for scholars. He has also been actively involved in sports development and served as a representative in the University Sports Council. A respected member of several professional bodies, including the Parasitology and Public Health Society of Nigeria and the Zoological Society of Nigeria. Professor Oniya is also a reviewer of several academic journals. He has published over 55 research articles in reputable local and international journals, authored 2 textbooks, and developed undergraduate and postgraduate curricula. His research has garnered recognition, including a TED Fund grant for studies on karyotypic, morphometric, and histological characteristics of anurans in Ondo State. Outside the university, Professor Oniya has been an advocate for sustainable urban farming through his innovative system known as sacriculture. By growing crops in sacks, he has demonstrated the feasibility of urban farming, even in areas with limited space. His initiative has enabled city dwellers to cultivate vegetables, maize, corn, yam, and other crops in residential homes, promoting food security and healthier environment. In 2023, Professor Onia delivered the 109th inaugural lecture at the Federal University of Technology, Akure, titled Deliver Us, O Host, from Eradication. The Parasites Prayer. I'll take that again. Deliver us, O host, from eradication. The parasites pray. Highlighting the importance of health and healthcare in the fight against parasitic diseases. Professor Onia is happily married to Matilda Motunrayo Onia, and they are blessed with 3 daughters. You can now put your hands together. Ladies and gentlemen, please join me. Welcome Professor Onia to the microphone. Another round of applause, please.
The Vice Chancellor, Deputy Vice Chancellor, other principal officers, Dean of the Faculty of Science, the Vice Dean and former Dean, heads of departments in the faculty, members of the faculty, erudite students, distinguished guests, gentlemen of the press, ladies and gentlemen. I'm extremely honored to stand in for my mentor, Professor Alexander B. Odaibo, a teacher and researcher par excellence, to deliver this keynote address. Professor Odaibo would have been here today personally, but for the conference of the Zoological Society of Nigeria, going on as we speak, at the Federal University, Benin Kebbi, far away in Kebbi State. He is the president of the society, and as such, his unavoidable absence. He sends his utmost regards and goodwill. Every academic meeting is an avenue for exchange of knowledge, deepening of collaborations, and examination of the status quo for a better tomorrow. Before I proceed, please, I've made this presentation a read-through presentation, and I'm leaving the material as soon as I'm done with that. Our knowledge of and research into science in relation to nature is all aimed at promoting good quality life and maintenance of our environment, amongst others, with a common denominator, that is good health care. The healthcare situation in sub-Saharan Africa continues to dim for the bad reasons ranging from non-availability of functional systems, poverty, manpower deficiency, lack of political will, neoliberal policies, and bad leadership, to mention a few. Nigeria is not exempted from this seemingly inefficient system of healthcare practices, with a population of over 200 million people. Our role as scientists is a challenge to use our knowledge and skills to ameliorate these living and life conditions, because health is life. The theme of this lecture, the future of precision science, and by the way, I'm really excited that we have the future of science in the secondary school students here. Please pay attention, you might get some motivation. The future of precision science, integrating multidisciplinary research for tailored healthcare solutions, is particularly refreshing and hopeful in a population that suffers daily mental issues encapsulated in different forms of depression. Practically, every 1 out of 3 Nigerians is in need of a medical intervention or two, which most times are elusive. And so, whatever will bring hope is always welcome, provided it is available and affordable. The current trend in research is multidisciplinary collaboration as opposed to sole investigation, and thus the reflection of the theme is apt with modern trend. Before I go on into the main discourse, permit me to take a walk back into the science of anthropology and try to lay a foundation for precision science. It is unequivocal that science adduces the origin of species to evolution, and currently Homo sapiens tops the table in all traits, sitting comfortably at the top of the food chain. The evolution of the hominid line began about 6 million years ago in the Cenozoic era. Humans and apes share a great evolutionary ancestry, with the latter being the precursor to the former. Despite anatomical similarities, apes are also social animals. They live in family units with a definite leader and are known to display intelligence in problem solving, particularly chimpanzees and bonobos. The evolutionary advancement of the genus Homo over the apes is basically threefold, and these are: 1, intelligence. As you can see, the slide is not rolling, please. It's not showing. There are some things I want. Sorry, just a little technical itch. We'll get that resolved. Okay.
You may have to just continue. The system is having problems. Try change it now.
Do I bring my system? Because I want to speak to this. Do you understand? Let me bring my system.
Do you have it?
It's on my system. No, it's not on. I hope the power is going to be on. My battery is not working. Still at the single map. I'm just putting it on. What I'm going to recharge
ṣàrí báyìí pé ọ̀dọ̀ wọn ti gbé jáde báyìí.
So sorry about that, please. You know, these devices at times they have a mind of their own. Right, so we are back on track, please. Right, so as I was saying, the evolutionary advancement of genus Homo over the apes is basically threefold. And these are: one, intelligence. And please pay attention to this. In the evolution of life, particularly the animals on this earth, humans and apes share the closest ancestry. But along the line, there were divisions that showed advancement. And I've now gone down to three basic ones. The first is intelligence. Here we look at the brain volume of apes, particularly chimpanzee and that of man. In terms of intelligence, the genus Homo shows a lot of advancement over the apes. We are more intelligent, and that speaks for something: intelligence. Number two, Homo sapiens evolved bipedal gait. That is, their ability to walk on two legs. Our ancestors were quadrupedal, walking on four. All appendages were on the ground, moving, but Homo sapiens from Homo erectus more or less perfected the bipedal gait. That gave our hands freedom for other things to use. And finally, the precision grip. These three traits show advancement over the apes, and that speaks for something. Basically, there are two types of grips a primate can display: the power grip and the precision grip. The latter evolved with the genus Homo, and it is demonstrated by the tip of the finger being able to touch or align with the tip of the forefinger. This simple grip, which apes are incapable of, is responsible for huge technological advancement demonstrated by Homo sapiens in conquering the environment and solving problems. The simplest example of this application of the precision grip is the ability of man to thread a needle. Precision ramifies into technology, consistency, finesse, advancement, ease, quality, and so much more to bring about comfort and convenience. Indeed, man is the better for it with this evolutionary advantage. Standards for quality healthcare services. Health regulatory policies are frameworks that guide the delivery system. These policies are largely drawn as a global template by WHO, where nations are expected to domesticate, quantify, or qualify such frameworks in the provision of a total healthcare delivery system. I want to present to this meeting as an example the WHO Global Standards for Quality Healthcare Services for Adolescents. The document, though emphasizing on adolescent healthcare delivery, nonetheless is a good template of tailored healthcare solutions. The document is in part identified 8 global standards which define the required level of quality in the delivery of health services to the target population. These standards, for emphasis, are paraphrased below. Standard 1, adolescent health literacy. Here, the health facility implements systems to ensure that adolescents are knowledgeable about their own health and they know where and when to obtain health services. Standard 2, community support. The health facility implements systems to ensure that parents, guardians, and other community members and community organizations recognize the value of providing health services to adolescents and support such provision and utilization of services by adolescents. Standard 3, appropriate package of services. The health facility provides a package of information, counseling, diagnostic, treatment, and care services that fulfills the needs of all adolescents. Services are provided in the facility through referral linkages and outreach. Standard 4, providers' competencies. Healthcare providers demonstrate the technical competence required to provide effective health services to adolescents. Both healthcare providers and support staff respect, protect, and fulfill adolescent rights to information, privacy, confidentiality, non-discrimination, non-judgmental attitude, and respect. Standard 5, facility characteristics. The health facility has convenient operating hours, a welcoming and clean environment, and maintains privacy and confidentiality. It has equipment, medicines, supplies, and technology needed to ensure effective service provision to adolescents. Standard 6, equity and non-discrimination. The health facility provides quality services to all adolescents irrespective of their ability to pay, age, sex, marital status, education level, ethnic origin, sexual orientation, or other characteristics. Standard 7, data and quality improvement. The health facility collects, analyzes, and uses data on service utilization and quality of care disaggregated by age and sex to support quality improvement. Health facility staff is supported to participate in continuous quality improvement. Standard 8, and that's the last one for WHO on adolescent health provision. Adolescents' participation. Adolescents are involved in the planning, monitoring, and evaluation of health services, and in decisions regarding their own care, as well as in certain appropriate aspects of service provision. On its part, the Nigerian Ministry of Health's National Health Promotion Policy indicates that health promotion is an effective tool for galvanizing individual and collective health actions aimed at preventing diseases, improving the health and well-being of the populace, as well as ensuring a healthier society for all. To achieve this, the document espouses a set of general objectives which are target marks for implementation, monitoring, and evaluation. These are also paraphrased below. A. To foster health promotion interventions targeted at addressing social determinants of health, reducing inequities, and tackling priority burden of disease in Nigeria. B. Facilitate health promotion interventions in support of government's efforts directed at ensuring and sustaining healthy behavior, healthy lifestyle, and enabling environment, including healthy public policy. C. Enhance human resource and capacity strengthening for the delivery of health promotion interventions. And D. Strengthen systems to monitor, evaluate, and manage evidence related to health promotion interventions. Each of these objectives is rolled out in a retinue of action plans targeting multi-dimensional collaboration for implementation. Precision science, integrating multidisciplinary research for healthcare solutions. Research designs are guided by the research goals and objectives, and these are need-driven investigations. In the health sector, need-driven research could be basic or applied in trying to solve a particular problem. Whatever objectives are set, the health sector must recognize the importance and relevance of operational research outside health facilities to strengthen deliverables in the overall system. Integration of ideas and skills must be multidisciplinary, robust, and relevant. The future of medical solutions is very bright, as precision science will eventually change the narrative of healthcare delivery. The key drivers are state-of-the-art technologies in artificial intelligence, precision medicine, genomics, integrative data analysis, synthetic biology, next generation sequencing, immunotherapy, pharmacogenomics, electronic health records, wearable devices, etc. The intention is to tailor intervention and health management to an individual's unique profile. The deployment of these methods will enhance decision-making, leading to personalized health management, reduced adverse reactions, timely and direct intervention, better prognosis, and increased efficiency, amongst others. Now, look at this chart. Where we are born with precision science and where we are now. Where we are now is highlighted in blue. That is, if you go to the hospital, 3 people go to the hospital, they present with the same set of symptoms. They get the same treatment. If it is malaria, you all get either chloroquine or artesunate for everybody. That is where we are now. That's the blue. But where we are going with precision science is the green. You have tailored therapies. If 3 people present with malaria, they may need different treatments to get it resolved. That is where we are going. So I'm trying to move from the blue to the green. That is all about precision science, and that is beneficial. Because on the blue side, some people get well, some don't get well, some develop adverse reactions. But precision